And we're here this week at Advent at one of their EMS and emergency symposiums here in Central Florida. And in the exhibit hall, we're always looking for new toys. And specifically, when we came across this one, we've got this week's Gimme Five. And I'm joined this afternoon by Amanda, who's one of the educators here for Cerebel. And Cerebel is really interesting idea, especially with me personally, having had my last seizure just a couple months ago. And when it comes to seizures and you're monitoring your EEG, you can do the fancy put paste over your head, put all the wires over your head, and it seemingly takes longer to go ahead and get prepped for the EEG than it actually takes to do the EEG. However, with that really neat toy that I'd heard about but never personally encountered was Cerebel. And Cerebel, as Amanda will show you, is something that can be done in the emergency room in less than 5 minutes to go ahead and figure out, is this person still actively seizing, even if we can't tell that they're actively seizing. So, Amanda, if you would, can you show me how this works?
Yes, absolutely. So Cerebel, like you mentioned, it's a point of care EEG. We have two different sizes. So we have a medium large and a small. Medium large is going to fit most patient population. Our small will fit up to pediatrics. We were looking at a growth chart. It will fit most 1-year-olds, average circumference of head. There is a tool to measure for if you're unsure on what size to use. So for a quick setup, you're going to take your headband. There's a little back tab right here. And you're going to place this around your patient's head. All right. So once you got your headband on, you can go ahead and connect to your recorder.
Utterly painless, by the way. No goop. Literally, she just wrapped it around my head. We're ready to go.
Yes. And so we're going to go right here to our seizure burden strength. This is going to be a great device and a great tool to show you is your patient having a seizure. So it's a 5-minute reading, AI-powered point of care. So if your patient is reading at a 90%, that is saying that your patient has had 4.5 minutes of seizure activity, and you're going to get an alarm, okay? That's great. We're going to go ahead and give some medication and treat this patient.
Because what does it say when it pops up?
It says continuous seizure suspected.
So there you go. It's kind of like doing the fancy 12 leads, whereas you can read it, or you can figure out what does the EKG machine say. It's not perfect, but it ain't half bad. And if it says you're having a big MI, you're probably having a big MI. And in this case, it says you've got really icky seizures detected, even if they're not going like this, because that's simple.
Yeah.
You can go ahead and tell that something else is going on.
Correct. That's not the patient that you're going to want to put this on. It's a patient that's actively having a compulsive seizure. These are for those that are non-compulsive. If your seizure continues to read for 10 minutes, you are going to get a secondary alarm that your patient is in status epilepticus. So this is brain is on fire. You need to treat. This is, there's something going on.
And if they're not seizing?
If they're not seizing, you're going to...
What does it say then?
Nothing. You're not going to have anything. It's going to go down to 0%. If your patient's not having a seizure, you'll just see 0% on here. That's great. We've ruled out if that patient's having a seizure, and we can move on to the next line of treatment.
So again, if you've got somebody who's actively seizing, they're tonic-clonic, you can see that they're shaking, baking, and having a seizure. That's not difficult. However, in this case, if you've got somebody that you've given them boatloads of drugs, or even worse, if you've given them boatloads of drugs and now they're chemically paralyzed, whereas you can't tell that they're still seizing, that's huge because you can still be seizing, we just don't know about it. So in this case, as she touched on now, literally from 1-year-old on up, you can go ahead in less than very few seconds, wrap this around your head, hook it up, and it says you're in status, you're probably in status. Even if you don't look like you're still in status, and you can go ahead and give them drugs and get them where they need to be. Amanda from Cerebel, thanks so much for your time.
Thank you.
Appreciate it very much.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best, under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next PEDS patient could be your worst PEDS patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.